Hello and welcome once again to the Health Hour on Andy TV. My name is Patricia and I'll be your host for today. I've got my colleague here with me, Horcelie, and we have Dr. Rex today in the studio. This is the show where we talk about health, where we put the health of our community, of our loved ones at heart. Today we'll be discussing a very interesting topic. We'll be talking about autism. Autism is quite common, more than what people think. In the UK alone, we have over 700,000 people who suffer with autism. So it could be that your loved one, your child, a friend, a family member, or someone that you work with may have autism, which you may never know. Today, I would like you to join us on the show where we'll be talking about autism and everything that we need to know to help each other to support people with autism. Welcome to the show, Dr. Rex.
Thank you.
Dr. Rex is a pediatrician consultant who works with the North East London NHS Foundation Trust, precisely in Barking and Dagenham. He has been working as a consultant since 1998. So today we are very lucky. He has a lot of experience that he's here to share with us. He also acted as a Deputy Interim Medical Director in the North East London Foundation Trust in 2013. And he has also contributed to the Children Autism Strategy, which was done 2015 to 2018, which is quite current, for the London Borough of Barking and Dagenham. It's a pleasure to have you on the show today.
Thank you.
So today we'll be talking about autism, as I've said earlier, just to help our viewers and people out there watching us. When we say autism, what is autism?
Right. Autism basically entails children's development where they have difficulties with social communication and social interaction. And in addition to that, they have restrictive, repetitive behaviors that affect their overall functioning within the community. And in addition to that, this usually will start early on in childhood. Mm-hmm. But I would like to look at autism coming from a different angle. If anybody, any child that is born today develops, and as pediatricians, we look at the developmental profile of the child, how they are going to walk, how they're going to communicate, how they are going to learn from their environment, how they are going to play and socialize. So these are the 5 areas that we look at. But with autism, it's affecting mainly their communication, their social interaction and play, and in addition, having that repetitive behaviors. So a lot of patients or families may come, say, if only my child could talk. Mm-hmm. But then we are looking at the whole aspect of the child's profile before we come and say that, okay, your child may or may not have autism.
Yeah. Okay. So what are some of the signs, apart from, you did mention about parents asking if only my child can talk.
Yeah.
What are some of the signs that you will pick up at an early stage in a child that will make you think that this child might be autistic? Yeah.
Yes. If you bear in mind, I said the developmental profile involves how my child is going to walk. It doesn't matter how long you take your child, a newborn baby, to the gym, it's not going to walk. Or it's ready. Okay. Yeah. And that's the profile that we need to look at. When is an activity or a development supposed to arrive or to be seen in a child? So when we talk about communication, how is your child communicating? So communication could be looking at you, smiling, interacting with other members of the family. So if a child is not doing that from the start, then you begin to wonder. Or if a child is looking at more objects than human beings. So for example, you pick up a child and is now looking at your, let's say, a chain
that you're wearing. Instead of giving you eye contact
and having that social connection. And then again, also when the child is coming to use language, so kids will start or using understandable words, but they'll be babbling, they'll be cooing, and they'll be making what we call when you talk to babies in a baby language, they respond, depending on their age. And then when it comes to the point of talking from one year onwards, that they may be using mama and dada, if those things are not coming as you would expect, then you need to begin to seek advice. So you are looking at the social interaction, you are looking again at their communication skills, and then you look at their play. What is the child playing with? Kids like to play. There's no child who doesn't like to play. But if, for example, your child, you are buying toys, and he's not interested, then you begin, what's happening here? All is interested in these quote-unquote inanimate objects. Some may start even playing with your pots and pans instead of playing with real toys. And they are looking at noises and things. So that will be the core areas. But the other side of it also comes with what we call the sensory difficulties, which would be to sound, which is the common one that people will say that my child always is holding his ears. He doesn't like the sound of the Hoover or so sound is there, and then taste. So you may have difficulty with feeding, and especially from weaning from liquids and adding textures. So when difficulties are coming around those areas, then you begin to worry. Because, I mean, as parents, you want our child to survive, so we do all the corrections for the child.
So when you say difficulty in feeding, is it like the type of food or they struggle to eat?
It would be the type of food, or they may stick to one brand, one particular thing. So maybe if they're on breast milk, that's all they want. They don't want anything else. When it comes to weaning and you're introducing soft and then thickening the food and introducing storage, they start spitting it out, or they don't want it at all. They still want to go back to the same thing. So when there are difficulties with textures, so they'll feed, but the food variety will be limited.
Okay.
You spoke about language and how if the child is finding it difficult to kind of interact how a normal child should be interacting, how do we then label it, how do we then call it autism and not just learning difficulties? Because some children just have learning difficulties.
Okay, so we look, when we come in to make a diagnosis, it entails a whole lot of history from pregnancy through delivery, and then what has happened to when you presented to us. So it's not a one snap. We take a history across. So we would then begin to look at, is this child having a delay? Because there's a difference between a delay and what we call a disorder. A delay means that you're going to get there, but at a longer time. So if you have quote-unquote weak muscles and you are expected to work at, let's say, 1 year plus up to maximum 18 months, and then because of your muscular difficulties, you are not able to work at 18 months, but the trajectory shows that, okay, you are rolling, you are crawling, you are pulling to stand, so you are going to walk, but at a later stage. So that is the delay. But in the same way with language, you look at the trajectory. So has this child been making noises? Has the child been making the right noises? Has the child been imitating and copying back? If the child is not and has been stuck and is using things in a different order, then we may call that as a disorder. So the understanding of, if I can step back once, when we talk about language, in fact, I would like to use the word communication, because it's you are receiving the information. So as child will receive the information, process the information, and then give an answer.
Response,
So that is a communication. So what is that child doing when it comes to the receiving? So for those who have had children who have difficulty with their communication, people will say, okay, go and do the hearing check. They want to exclude that. So if you can hear, then why are you
still acting?
And then someone who has, even if you are deaf, socially you're okay.
Of course.
Okay. So we look at the whole picture rather than
So I know a lot of people do link autism with genetics as well. Is it quite a genetic disorder?
There's I mean, with the literature, there's some genetic predisposition, because there are findings in identical twins where both of them would have autism. So there is some, but a gene has not been identified as a cause of autism. That's the principle. And then we know that there are families also where the first child may have autism, two more may have autism. So there may be some genetic predisposition. But with there's no identified gene to say this is the cause of autism.
Yeah, that reminds me with the how do you call this, the Down syndrome, which there is an identified gene that causes it.
That causes it, yeah. And we also know that with certain syndromes also, the predisposition to autism is high. So, for example, if somebody's got Down syndrome, it does not mean that they cannot have autism.
Oh, okay. I didn't know that.
So they can have both.
Yes, they can have both.
Yeah,
so you are not, all of us are not excluded from any disease. So the fact that you have this doesn't mean you can't. So you've got to just tease the symptoms out and manage each as it comes.
Right.
Yeah. So there are certain predisposing factors that we are aware of that would make the diagnosis not easy, but would help us come to a reasonable diagnosis.
So is it a cause by like the child's upbringing or social circumstances? Because some people may say, oh, because the child was raised with a mother and father, because the child was born as a single mom, is that those causes? Because some of those things kind of raise.
I think it's not something that you can blame a child's upbringing, you know, because you see it in to kids that and we shouldn't go there. It doesn't. It's not.
It hasn't got any link.
It has nothing to do with
no link at all with social
upbringing.
upbringing.
With the upbringing.
Okay.
It doesn't.
So this autism, I mean, when I think about it, it sounds quite scary, especially where you hear like some people describe it as the hidden disability. But why do we describe it so? I
think for me, having worked with parents and having worked in an area of disability, I personally refer to it as the handler's disability. Handless. You don't have any handle to hold on. If your child came and he doesn't have legs, you know the child doesn't have legs, so you have no problem with that because you can see it.
Yes. Exactly.
But with autism, there's nothing you can hold on to. The child standing before you, for all intents and purposes, there's no defect within his outlook. Okay. Or unless there's a syndrome, then you can say, okay, maybe these are the other features. But more often than not, all these children are quote-unquote healthy, normal-looking. So then it's the developmental side of things then that becomes difficult. So a lot of us would hope that if I can only fix this, then the other problem, that's why parents may come and say, oh, there's nothing wrong with my child. He looks good, or she looks good.
He's healthy.
He's healthy, he's eating. He just can't talk. But that is not the case. So it becomes difficult even at the diagnosis for parents to accept it. I mean, there are some parents that you have to quote unquote walk the journey with them. Till they're able to accept it. I mean, I've got parents who sometimes it takes 8 years.
To get a diagnosis?
Not to get a diagnosis, but to accept.
Okay.
So what kind of support do the parents receive then for the child? Because it must be very, very difficult for them to bear as a parent. So what kind of support do they get in order to live with a child that is autistic?
Yeah, I think what we do, we will actually take you through the journey, through the diagnostic process. So you would have support from, for example, in my team, we have nursery nurses, we have portage workers, we have the speech and language therapists who will be working with your child even before you arrive at the diagnosis. So by the time we come to give a diagnosis, you may be aware of it. But having said that, there are some people who still have the difficulty. Because to be honest, it's not easy. I mean, I always give the example, for example, if you're you've packed your bag and baggage and you're going to South Africa, and then the pilot tells you, oh, I'm sorry, we are now in Greenland. How would you feel?
Scared.
You're not ready for it. It's not something you prepare for it. So parents are not prepared to have a child,
Yeah.
for all intended purposes, who
With any disability.
And therefore the whole picture changes for the family.
Exactly.
And then that's where they need the support. So there are voluntary organizations within various trusts, and the common one that we use now is the National Autism Society website that people can go for information. They can link up with people where they need support to do their work.
So can you say that again? National
Autistic Society.
National Autistic Society. Okay.
But local boroughs would have their own family groups or voluntary. I mean, in Back in Dagenham, we have the Sycamore Trust, and then we have the Heathway Center where people go and have information and support from.
So are these support there for just the children or for the parents as well? I mean, I'm just looking from a parent's perspective where you will be going through some challenges as well in how to handle the child, you know, financially, emotionally, psychologically, what the parent will be going through. Are there facilities or support for them as well as parents?
As parents, there's a support for parents. I mean, we used to run what we call a post-diagnostic group, where it's just for the parents who can come along with run by the clinical psychologist, just to talk through what is going on. The financial side also, most of these will be qualified for social support and grants in terms of the financial side. So we point people in that direction. And then also, what becomes difficult again, which we don't have control over, becomes the interaction between the couple. How do they handle the child, especially where one agrees and the other doesn't agree? Then it becomes difficult.
That can cause separation as well between the two.
Separation. It's a difficult area.
So looking at the how to cope and manage such children, how are parents able to do this? Because they wouldn't have the support 24 hours at home. So how are they able to cater for these children at home by themselves?
The first thing that I would always say to families is that you need to understand what you are dealing with. You need to understand what autism is. And there's no two children with autism who are the same. They are very, very different. So you need to know your child. And to know your child, you then need to understand and know autism. And in Back in Dagenham, we run courses for families and for in fact for teachers, preschool teachers, and we allow parents to go on there. So when you understand your child, then you would be able to work with the child and then have the peace at home. Because when you don't understand the child, what behaviorally is normal for the child, you may think is abnormal.
Yes, of course.
And then that can create a lot of conflicts and tension and confusion. But if you know that this behavior is within the context of autism, and this is how I can facilitate it. If I give an example, when I say to you that something is finished, what does that mean?
It's done.
Yeah, it's done. So if a child who has autism wants biscuits, you have a whole packet. You've given him 2, and you say it's finished. What have you done?
You stopped them from wanting more.
Yeah, because they can't see you because you're lying.
Because
he can see you holding a packet.
And you're still saying it's finished.
His dictionary of finish means gone.
Everything's finished. So
then there's already a conflict. So he starts throwing and rolling around, and then you don't understand why. Because you're not using the same language and the same definitions. Okay, so when you get to know these, then what will create a problem is no longer a problem.
So how do parents know the different spectrum? Because you just mentioned that every child, both child can have autism, can be autistic, but are completely different. I guess if you're a single parent, how do you manage 2 different types of autism, and what are these different spectrums of, if you had to simplify it?
When we use a spectrum, it's just talking about the differences in the manifestation of that particular. So we've mentioned social affect, social communication. We've talked about restrictive, repetitive movement and play. So somebody may not want to play with dolls. Another may play with dolls. So they still have difficulty.
Yeah.
Somebody may want to socially would not want to go to parties because it's too crowded and it's too noisy. Okay, but somebody would like to go.
Yeah.
Because they have the different, how do you call it? They have the different difficulties. I mentioned something about sensory difficulties in autism. We all use our senses in everyday life. When you want to eat, what sort of senses would you use to make a decision that I'm going to eat this food?
Taste in your mind as well.
Sight, smell, taste, touch.
Yeah.
These are 4 senses, which if they are normal, you work okay. But if you have difficulties in these, then what looks nice to you may not look nice to your child.
Yeah.
So your child takes one look at the food, it looks ugly.
Something that might be pleasant to you.
Something that may be pleasant to you.
Yeah.
And more often than not, for example, they may like plain food. So if he likes rice, it has to be plain.
No vegetables.
No vegetables. The moment you put vegetables in, it becomes something different.
But how does that affect their nutrition then? Because you can't just live with rice
every day.
Because they will eat other things. But you have to prepare it. That's when you need to know your child. And you need to introduce things in as he likes or she likes. Because nobody can force you to eat a food you don't like.
Yeah, of course not. No. Yeah.
So, are there any, financial support for parents as well? Because I've got a few friends who have children with autism, and from their stories, it's like when you're trying to shape up the child, when you're trying to introduce them to different things, like let's take food and toys, for instance, because there's some children who are attached to certain particular toys, and you try to break them away from that. So you have to actually invest in getting different type of toys so the child can have that. You need to take time off work and then be with a child for support. And sometimes with food, for instance, you have to try different type of food. If you are not earning much, so in terms of financially, how can this experience be supported?
The parents are supported based on whatever they put in, quote unquote, their DLA forms, which is a disability living allowance. So once your child is diagnosed, you have recourse to apply. And the application and what is given to you depends on how much extra you're doing.
Do you always need to wait for a diagnosis before you can get the support?
You don't necessarily have to wait for a diagnosis.
Okay.
But if you have the diagnosis, that is fine. But if you work with a clinician, can just put the diagnosis hasn't come, but can put the difficulties. So, for example, if I see a child and I think it's got autism, I may mention it to the parent, but then I'll describe the difficulties under the categories of the developmental profile. So I'll say, okay, this child has a social communication and play difficulty with restrictive behaviors. So it's a sentence, and you can read from the sentence. The disability allowance, I believe, is not diagnostic-led. It will be easy, but it is problem-led. So there may be, I know there are some people who may have a diagnosis, but they don't have anything. Because you're not doing much. The fact that you have a diagnosis doesn't mean you have a problem. That goes with it. Okay. And then there may be people who may have a higher rate, and there may be people who may be on a low rate. It just depends on how much extra you are doing for the child.
But that's all here in the UK, right? Yeah. You get this financial.
Yeah.
What about where we come from, African countries, in Congo? Are there international trustees or international, organizations that do help those who live in other developing countries? And
I think with developing countries is rather difficult because even there's no the setup to identify, make a diagnosis, manage them. It's a whole different ballgame. It may not be existing in its true nature as it is here. And if we go back home also, most of our social care are family dependent rather than government driven. And therefore there may be mileage in sort of looking into this further. And I believe there are some countries where autism awareness is being highlighted, and governments are coming into the picture. So the infrastructure may not be there fully as it is here, because there are two different areas. For example, in here, to go through the diagnostic profile and the management, you need maybe your health visitor to identify the difficulties. Do you have that structure, or there may be primary care workers, and do they have the tools to make that diagnosis and the referral, and then to which team will they make it to? So the diagnostic team is not a one-person diagnosis. You need the input from the speech therapist, the clinical psychologist, the pediatrician, and then maybe a nursery, a play nurse to have a look at this thing. So before you make a diagnosis, you have got involvement
with a multidisciplinary,
and then the approach to management in terms of the finance, schooling, and everything. So it's quite capital intensive.
So which is what we say we're lacking in African or even developing countries. Is those things. And going back to like Africa, you know, from a lot of our ways of dealing with health issues, and we do look at traditional things, a way to heal it. But the way you've spoken about autism, it doesn't look like, or doesn't seem like this is something that you cure. So based on our what can you say to our our African community? They understand it, because a lot of time we say it's a spiritual thing. You know, they go to a spiritualist to heal the child. Or even there's a cases where, you know, they kill the child, or you know the child becomes isolated. It's not part of a community. So how do we begin then to teach our community about these things, and not just based on our traditions? How do we begin to do that?
I think within the context in here, we need to look at first the primary family where there's the illness, and then how they can communicate to their wider friendship, because you'll be looked at in a funny way that you can control your child.
When they start, behaving in a certain way.
In a certain way. So the community itself and the people around you must begin to understand what you are dealing with. And I believe that when we start from our own little base, that will be more powerful. And then from there we go to opinion movers. So in a church place, for example, the churches, maybe the church leaders should be able to speak to people who are in the know, and probably once in a while go into the church, speak to people that, look, this is an illness, right? We will not stop your faith. Or your belief in making sure that also helps with the healing. But you don't do that in isolation. Okay. And also, it is not anybody's fault. So these are the three things we need to let the community know. Okay. So opinion leaders, as we do in this program here, your own family, your family members, and that is how we need to trump the autism and autism awareness, because a lot of people, when a child misbehaves, as I said, there's no handle to a child with autism. Okay, so you see the child, your first impression, oh, this child looks okay. This mother is not disciplining the child properly.
Like from what you're saying, there is this lady that I follow on Facebook, whose title her page is My Journey with Autism. So in her story, she's got a child with autism, and at some point she has to refrain from going to church because people did not understand. They will tell her, you know, take your child off so we can listen to the preaching. And it got to a point that it got so much into her that she has to actually stop going to church. Meanwhile, like you said, these are people that you would expect may understand or support you when you're going through such challenges. But, you know, I wouldn't blame people so much because lack of knowledge, they might not know. They do not understand the disability itself. you know.
Yeah, it's socially a difficult thing for the parent and the child. I mean, within my practice, I've seen a lot where people have become reclusive because they don't want to go out, they won't go to any social gathering because of the behavior that the child would put exhibit in their place. Some of the behaviors are not, again,
normal.
But again, you as a parent also would need to know your child. So if my child is sensitive to noises,
you don't take them
you don't do that because
in that situation. Exactly.
To fail.
Obviously, they are going to fail.
I think within this country, I know there are certain shops that they have, quote unquote, the autism hour. So then people can go and shop with their children who have autism with less crowd, less noises.
Nice.
So people are learning, and that is where, as you said, our country and our country people need to begin to learn and then make it aware. So, for example, in churches, I believe, so there are so many big churches where you can have people who know about autism. And even in the children's church, find a sensory area where the parents then can come and have maybe 1 or 2 church members who can supervise these kids. I mean, one of the family members told me the son always for some reason likes a particular, there are 2 people in the church that he likes. One understands him and the other doesn't. So the day that the one with the understanding is there, they are at peace. But the day that the one with the understanding isn't there, and then it will be a disturbance to the other one. He doesn't know. So he would, So
I guess it's also about training people how to supervise. Because before you know, some people start flocking the child, start beating the child because they just lack so much understanding. So what kind of training, like, for example, I don't come from a medical background. A normal, I would say normal because I don't come from medical, but what kind of training basic training would I receive?
So that's why I said in back in diagram we have courses, basic autism, and we do courses for like sensory.
Is it open to everyone?
It's open to all the parents, and in fact for teachers as well.
Oh yes, of course,
So that's where we have the training pool of teachers, preschool teachers. So
do you have to pay?
You don't have to pay.
You don't have to pay. It's free.
That's good. That's very free.
So you go in there. So once the diagnosis is made, we make sure, because when the family understands what autism is, they are more than able to handle and also pass on, because education is you spread it.
Yes, of course,
Okay. So, all right, viewers, we're just going to take a short break and we'll be back. See you soon. Welcome back, viewers. As we were discussing, we're talking about autism today. If you've just joined us, we've got Dr. Rex here helping us to understand what autism is. So, Dr. Rex, going back to the language and communication, as we live in a multicultural society here in the UK, I am from Ghana. So if I have a child with autism, we understand that their speech can be delayed, their communication can be difficult. Would I be doing the child any good or harm if I try to communicate my local language to the child?
I think what one was said earlier when I used the word communication. So first, is the child able to communicate using words? Because there are some children with autism who cannot use words. Or they don't use words. It doesn't mean they don't understand, but they can't speak back to you. So they will follow the simple instructions. So we are not we don't want to confuse them. In the world of the children with autism who do not have words to express themselves, what we use are more like pictures or objects of reference based on the level of the person's understanding. So when you are using the object of reference, you can also speak to the child in whatever language you want to. If you are using whatever.
So there is no harm in actually speaking to them in different languages or training them.
Supporting their communication with the picture. If I give an example, you may be speaking French
in Lingala.
And Lingala. If you went to a place where you don't speak, do you speak German?
No.
Let's take an example. If you go to Germany, you're at the airport and you desperately need to wee and you don't speak the language, what would you do?
I would look for signs.
Yeah, you look for signs.
I would look for signs to the toilet.
If there are no signs, what would you do?
I would go to someone. I'll have no choice.
How would you express your thoughts?
In non-verbal language, I presume.
I mean, for example, like as someone, people, we have a lot of tourists here in London. People always come to you and say, "Oh, I'm looking, place." They'll find a way using, you know, body language.
That way the child who is non-verbal and autistic, he knows what he wants. So, for example, part of their communication will be dragging you to the place.
Oh, okay.
And some may be pointing. So you need extra. You use the first thing. I'll look for signs. Signs are universal. Okay. So if the child is non-verbal, then you would aid that communication with pictures. So those who would have children will do what we call the picture exchange communication. So it adds to it and improves their communication. For those who have language, sometimes even the language they use have a restricted meaning. I had one child who, the first time he heard the name of a dog was, for example, let's say John. So in his mind, dogs are no dogs, but they are John.
Oh, wow.
So when you say dog, he doesn't see it.
I see.
Okay, unless you refer to it as John. Yeah. So you need to then understand your child. That's why I'm saying that you need to understand your child. Then you can use that appropriate communication tool
to support
them. And going back again to Africa, pictures are standard, but then you're using your language. So that would help the child.
The child development,
So there is no way that can confuse them.
So it shouldn't confuse. So far as you are referring to using the picture and then they are having the same understanding.
Right.
You remember we talk about the word finish.
Yes.
Right? So the understanding from you and the child should be the same. There's no variation.
And I understand some of them are quite stick to routines, and when things change, it becomes a problem.
Autism is very wide. Routine is their business. So changes sort of set them off. I have a parent who would, quote unquote, take the picture of the child's room before he cleans. She cleans it because she has to set everything where it is. If you, I don't know whether you've seen the people children with autism who can draw. So they go into a place and they draw exactly to the dot.
Isn't that OCD?
It's not OCD. It's part of autism. Part of autism. Something may do that. So they need it to be in the same place. So again, coming back, you should know your child and know how you can support the child. They like sameness, but you can always vary it slowly but surely along the line with the child. Introducing things a bit by bit, because it's not easy.
Now let's talk about stigma. You know, the stigma attached to this disability, which is preventing most parents to come out for support, even when they need it.
Yeah, but I think the stigma is an outside thing towards you, but you are the one who is feeling the pain. So you are the one who needs to take that boldness and come out and know that it is not your fault, because people think it's their fault. So once they realize that it has nothing to do with you. It was not the way you carried the baby. It was not one night that you slept or ate too much. It was not. It has nothing to do with you.
Right? But most often you see women are being blamed for whatever child they have than the men. You know, men do get away with so many things. Because some women are being blamed because they cheated whilst they were pregnant, because of one or two things they've done in the past. You know, being a curse from their family side and all that.
I've heard many things. One in particular, someone I know who's autistic, and someone in my Congolese community said the person gave birth to the child who's autistic because she was being promiscuous, because she's been around. So
it has nothing to do with that. There's nothing written about that at all. it has nothing to do with your past. As we said, there may be some people who may be genetically predisposed, and it's not the man or the woman. So if it's I mean, we had one child, quote unquote, like that, and from a background of Asian origin, and when the child had a genetic syndrome, and it was from the man, so that you could see how the woman was very happy that it was not it had nothing to do with her, but the man. These are cultural elements which we need as a society to grow out of course, to learn from it.
Because I think we are more quickly to blame than to accept.
Yeah. And again, that's again culture. Because if I don't know what you are bringing, you don't say to an older person that you have made an error.
Yes,
you can say that because I mean you accept, and after accepting you blame. So we don't search for the reason why something is happening.
It's happening.
We are quick to blame the devil, or blame the woman, or blame the background you came from, blame your parents. It has nothing to do with that.
You know, talking about blame and believing is cultural and religious, what will be your advice to parents that thinks that it's a curse imposed on them?
Well, in fact, within my practice, and after the diagnosis, I have the family back, and then have a frank talk as we're talking here. It has nothing to do with anybody. Your best bet is to hold on and understand the child and work with the child. A lot. I mean, if we go back again, culture, tradition, if we go back really way back, any child that is born disabled, sometimes they're being put in the river and things. So anything that looks a bit out of the norm becomes difficult to accept. But then we need to then go back and say, look, no, this is not the way. Where the more we talk about it, the easier it will be for people. And then the more people can also adapt their environment to cope. Because if you have a child with autism, if you are not careful, you may not even find somebody to babysit for you or to help you with the child care.
Exactly.
So unless a community begins to talk about it freely and openly, and then understand that this is not quote unquote demonic, this is not that, you also need to have some understanding of the child. Then you can cope. I mean, I had one story where a mother left the child in the care of the father-in-law, or the father-in-law, the grandfather. So he said, when quote unquote Tommy comes back from school, he likes a sandwich, just do the sandwich for the child. And then he likes some sweets and give him sweets. So when this guy came back from school, grandfather did the sandwich as mother is instructed. The boy will not eat. The sweets were there. The boy will not touch it. Again, it comes to the routine. So if mother had gone one step ahead and said, he likes his sweets in threes.
I see. So elaborating.
Exactly.
So when he comes back from school, give him 3 sweets. And when you do his sandwich, the leaves shouldn't be taken out.
Oh, wow.
It all have to be in. Okay, so now you've given clear instructions. So granddad will have a nice time with your son. But now there's a conflict. Granddad has done it. The boy won't eat. So the mommy came and said, and granddad said, what's wrong with your son? I've given him the sandwich and put the sweets out. He will not touch it. And you feel ashamed after hearing that. You see,
it needs to be in the same way.
So once you know the child, then you make the instructions clear. So part and parcel of it is our understanding, and also making people understand if we are even leaving the child in the care of somebody else, that these are the specific instructions.
So in a nutshell, most of the input or the support lies mainly on the parent.
Yes.
You need to know your child. You need to let others know your child.
Sorry, what if there are autistic children who are orphans? What is, because not everyone is born with they are born with mother or father, but the father may not be around anymore, both mom and dad are dead, or they live in a different country. Are there services to cater or to help to support orphans who are autistic?
Within this country, they may go on the fostering and adoption.
Yeah.
So when people are adopting, they state categorically the kind of children they may want to adopt.
Okay.
Some may will write, we can adopt a child with a disability. So that avenue is there. But outside the confines of the UK or places where fostering adoption is held, I'm not sure whether the same system may exist where we come from. So again, our social setting is different. And it may be difficult. So they may be in homes that
but people just don't know how to.
So if going back home, the basic teaching should be there and understanding, because it's not medicine, quote unquote, that you're giving the child a tablet to take, but it's just knowing how to explain that behavior and helping that behavior. Okay. That is the key. That's why I always say people need to know their children.
Okay.
For example, when I say, okay, what's the time? Time is abstract. And children with autism needs things should be definite. So when you say, okay, we're going to Ghana or Congo in a week's time, you know a week. But a child with autism may not even know a week.
Oh, I see.
It doesn't matter their age.
Some of them doesn't matter their age. So you may say, okay, come back to you and say, when are we going?
They'll keep asking you again.
And then you can get offended. But one of the mother's device that she uses is sleeps. So she gets a calendar and then take the sleeps. So I say, when are we going? Then it says, how many sleeps?
Oh, I see.
You see what I mean? So that's why I always emphasize, know your child. Know your child. We can give you the principles, but when you know your child and you begin to apply those things, and once you know that, you can share it with whoever is close with you or looking after the child.
Okay. So before we go, Doc, I would like you to emphasize again which areas, which sites that parents can go to get support.
Yeah, I think within the UK, your local borough would have structures to support children with disability. Nationally, we use the National Autism Society website. That is where we use a lot because they've got information from quote-unquote childhood to adulthood. So whatever you need to know, they've got information on how to help children communicate, social stories, and they can also guide you, school support, what sort of structures, the educational health care plan, all those sort of things, they will help you there. So do not feel alone when you have a diagnosis of autism made. First thing is a diagnosis. It is not your child. Second, understand your child's difficulties and how to help the child. I always say to families, behaviors are a form of communication. So if your child is behaving in what does not look a normal way, why is he doing so? And then you can help that child out of it. The third bit is that you've got a social support. The government has the disability living allowance in place. And then there are local support groups and structures as well. Certain boroughs would have structures, especially in the holiday periods, where families can go to and seek help. Some boroughs also would have days that the children with autism can go and spend and spend time there. And then the fourth bit will be there are other voluntary organizations that support autism. So don't feel alone. Always ask the question and people can help you.
Okay. Thank you very much. So viewers, don't feel alone. There is always support out there. We are privileged to be in this part of the world where there is support. So please, do not stay at home. Do not suffer alone. There is support out there. On our next segment, we will try and get a parent on board who has actually experienced it, living with a child with autism, to help you understand that you are not alone.
Please subscribe to Andy D TV on YouTube and follow us on Instagram and Facebook.
See you next time. Keep watching Andy D TV.